28th May is celebrated as International Day for Women's Health and Menstrual Hygiene Day. As more and more efforts are being taken to create awareness about different aspects of women's health, today we bring a very special session. Let's talk periods, because we believe that together we can build a period friendly world. Let me introduce to you our today's expert panelist, Dr. Shrestha Manjrekar, a consulting gynecologist and fertility specialist at Manjrekar Hospital, Belgavi. Welcome, Dr. Shrestha.
Hi, thank you, Dr. Sathe. Thank you so much.
So let's begin the session with the basics. What is menstruation or periods? What to expect when we start menstruating?
Okay, so menstruation is like a medical term of something which means the onset of periods in young girls, and this in our population it can be anywhere between 11 to say 13 years of age when the girl is expected to get her first period. So we call this as get menarche or onset of periods. Menstruation per se is the term which we give for the ongoing bleeding during a period, and it may last anywhere between 3 to 5 days to sometimes to 7 days. And it is the most normal, physiological, or absolutely quintessentially normal part of being a woman. And in very simple terms, it is how a young girl becomes a woman.
Yeah, wonderful. It was so simple to understand, because what happens is, as a woman in 40s who has grown up, there was a lot of hush hush about around the periods. We were not supposed to talk about it. It is so great that now we are talking about it, and it is so important that our young girls are getting this information at the right age. Also, many of us experience cramps or pain during periods. So,
Yes.
why is so?
So, periods are usually this. What do we mean by period blood shedding? Is basically the inner layer of the uterus or the endometrium being shed cyclically every month at an interval of say 28 to 30 days, which is lasting for about 3 to 5 days, like I just said. Now, when this shedding happens, there are certain chemicals which are secreted in the body, which leads the uterus having some mild amount of cramps or contractions. Now, this is the reason why we do appreciate some amount of cramps in periods. This is also a normal phenomenon. Some women do not appreciate any pain at all. That is also normal. Some women appreciate lot of pain or lot of cramps, becoming a little more uh, uncomfortable to them to get to work or to go to school. That could also be normal, but that needs to be evaluated before labeling it as normal.
Is there any specific exercises or anything can be done during the any positions that can be followed which can relieve the pain?
Since I said it is mostly because of uterus getting its contractions, external muscles most often do not cause any effect when it comes to relief of pain. That said, a lot of women do appreciate a little relief when they, intake some amount of maybe hot the dark chocolate, because that is said to have a lot of endorphins, which causes relief of pain. Some women do appreciate a lot of relief in pain when they have some hot water bottles being applied to the lower abdomen or to the back. Some women appreciate a lot of relief when they are having certain exercises of the back. Most often women complain of pain in the lower back or lower abdomen. So in this area, if we do certain conservative management, like certain exercises or hot water baths, that could be also helpful.
So there is no harm in doing hot water fermentation or certain exercises.
Definitely, definitely. And when I say hot, I would specify warm, meaning some women do believe that it needs to be very very hot, because then otherwise the hotter it is, the pain relief is better. That is not true. And some amount of moderation, even in diet. Sometimes caffeine is said to improve the effect your efficiency during a period. Now, suppose you're particularly uncomfortable and you're powering through with caffeine, it is not really recommended because it increases the dehydration and that worsens the symptoms further. So reducing the amount of caffeine, improving oral hydration in the sense a lot of water, other fluids, and some amount of hot water bath application, some lower back exercises if required should be helpful. And
So
that said,
as
if
we
this is not helpful, I think it needs to be evaluated first before.
okay. So after doing all these things, hot water fermentation, taking little bit of exercise, as well as following hydration, if you are still experiencing intense pain, it needs to be evaluated. There can be some underlying cause, and it is better to visit your gynec. Thank you so much, Dr. Shrestha. As we are talking that it is body's natural phenomena, it is the most natural thing which is happening to us. So, is there, of course, the food and nutrition will have impact on it. So, how does our nutrition affect the periods, or are there any foods which should be included when our girls start their periods?
So when we do see young girls getting their periods, firstly, most of them are on the lower side of their growth curves, which means that they are not adequately weight. The weight is not adequate for their height. Now, for this doesn't mean that they are malnourished, but the micronutrient profile might not be enough. Now, what do I mean by that? The two things that they need to start improving in their dietary intake is going to be protein and iron. Sure short loss of iron takes place due to the bleeding every month, and as a population, we are not very iron sufficient. So we need to be very actively improving iron intake. This need not be tablets. This needs to be maybe a simple green leafy vegetable every day in the meal, which is very cheap and easily available. And it may not be very easily accepted by young girls, but it needs to be reiterated time and again. Protein is very important. Why? Because young girl, has just gone through her peak, velocity of growth. She's just attained her maximum height. She's had development of secondary sexual characteristics, by which I mean breast development of certain parts of her body, which she was not very aware of. So this girl needs to also understand the importance of proteins, which may be vegetarian or non-vegetarian. So nutrition definitely will play a huge role in two things. Number one, how she does manage the symptoms. Suppose if she gets a period, she's particularly uncomfortable, how she's able to manage with that. Or if she's having certain period-related issues, suppose heavy bleeding, scanty bleeding, any of those issues, she can fight it better if her immunological status is at a better state.
So of course, to have a balanced diet, because it also coincides with the period of maximum growth. But at the
Yeah.
same time, specifically, the iron is important because there is blood loss, and protein because they are at the maximum growth. And
Yeah.
as Dr. Shrestha rightly pointed out, they need not be tablets or they need not be some fancy foods. You can include simple green leafy vegetable, which can be, if it is not acceptable for your child, for your daughter, then you can really camouflage it. We are very uh, we
Very
are
adept. Yeah.
very, are good as mothers to camouflage things. We can put it into the parathas, we can put it into the cutlets and make sure that the girls have it.
Yeah.
Thanks, Dr. Shrestha. As you were talking about, there are a lot of changes which are happening in the girl's body at this point. So there are also the physical and the emotional or mental changes which are happening. So your take on that and how to handle it.
It is a little upsetting. Why? Because the emotional part of it or the hormonal changes that happen during a period or before a period are ridiculed, and we often call premenstrual syndrome or PMS to be a point of ridiculous, when we are ridiculing someone. And that's not fair, and it is something which is naturally a part of every cycle. So there's certain hormones which are increasing and dropping, and they are messing with your psychological state, mental state, physical state as well. um, even if it is a point of ridiculing someone, I still would like to say that it is not something which needs to be putting women on the back foot. Young girls need to understand that this is going to happen for a long time. So they need to start understanding that it is normal and we will be able to cope with it with time. Um, elder women, as time passes, some women do get particularly uncomfortable with it. Then that is the time that they need to seek medical help. They need to understand that not everything can be dismissed as normal, and they need to be evaluated properly before we give them any medication if required. And mood swings per se, even during a complete menstrual cycle, which is actually 28-day long, is always expected, but it is not always to be labeled and as something which is making a woman weak. It can actually be very upsetting to women who are particularly uncomfortable with it. But there are a lot of women who have no symptoms whatsoever when it comes to premenstrual um, upset feelings of being upset, being anxious, tearful. Sometimes their breasts are particularly uncomfortable. Sometimes they have physical changes where there is acne breaking out on the face. There is uh, particularly ugly looking zit on their face and they don't know how to get rid of it. But this is where we do counsel our patients time and again that when we say acne, it is not this that we are talking about. We are talking about complete flares throughout the cycle that needs to be particularly addressed as something abnormal.
So, whatever changes you are experiencing, they are more related to the hormonal changes which are occurring in your body. There can be slight irritability, mood swings, or feeling low, or there can be little bit of tenderness in the breast. All these symptoms are normal. If you are not able to take care of it, they are making you uncomfortable and they are interfering with your day-to-day activities, it is always better to consult the expert. They will be able to give you solutions which will make you comfortable and they are not putting you on the back foot. We have to understand this is a normal phenomena, and we as a women become stronger because of it. So thank you, Dr. Shrestha. uh, at the same time, we have covered that in the when the girls start their period, sometimes they are irregular. So,
Yeah.
for how much time that can be expected, and when is the time when they should go and consult a gynec?
Most often, when a girl gets a period, it may or may not be followed by subsequent periods at regular intervals, by which I mean sometimes some girls get periods at 15 days intervals, or maybe some girls might get a period once and then after 3 months or 6 months. Now, this happens because the access from our brain to an organ called pituitary and our ovaries, our brain and our reproductive organs have an axis by which they communicate with one another. Now, this axis has always been active in our body, but it gets a fresh new push when a girl becomes mature or she starts getting her periods. Now, this axis might take as long as 2 years to become mature. So sometimes, when a woman or a young girl comes to us saying that periods have been irregular, we always look at the timeline. That said, we definitely evaluate it first because sometimes it may not be just because of the immaturity of the axis. There might be other underlying problems. Without looking for them, we need to be very mindful as to if we are looking at some other problems. But uh, in a young girl who has just gotten a period, a mother being very anxious that the next period hasn't come in a month's time, I would definitely reassure saying that let's wait for another month and let's see.
So the duration is, we can say, between 3 to 6 months for the.
The duration is 2 years for
Okay.
the maturity to come in. But
Okay.
if a young girl has gotten her first period and hasn't gotten her next period in a month's time, then we can wait till up to 3 months or say sometimes 2.5 to 3 months for her next period to come. If not, then it's always a better idea to get evaluated and then wait for the next periods. Sometimes we do not get it evaluated, and there have been cases where a young girl has gotten a period once and then no periods for 3 to 4 years. That becomes a problem for us to evaluate again.
When you are saying evaluation, are there any tests, or are there
So
investigations?
the first part
Or
of evaluation is going to be an examination, a gynecologist examining the young girl. Second part of the evaluation is going to be an ultrasound and some blood tests.
okay. So, as pointed out by Dr. Shrestha, that it can be irregular in the beginning because the new pathways or new reflexes are being formed up to 2 years. But if at all it is irregular beyond 3 to 4 months, it is always better to go to your gynec and evaluate. Okay. So,
Yeah,
coming next to, we have been talking about menstruation. Let's come to the menstrual hygiene part of it. So, what
yeah.
are the different aids which can be used during the periods?
So there are multiple myriad of options right now when it comes to menstrual aids. The first and the most commonly used in our urban population is going to be disposable sanitary napkins, and they have been available since about 50 years now and becoming more and more popular because of the ease of use. The second aid that has been recently repopularized is going to be reusable sanitary napkins, which are made up of cloth. Now, this was something which was used since forever in another form where mothers and grandmothers used to help young girls in their first period with a neat cloth, clean cloth, which is to be used every 4 to 6 hours, changed, cleaned nicely, put it in the sun, dried. We are going back to our roots basically, and that is good because it is helping us going towards sustainable menstruation. The third aid, which has now gained a lot of popularity in terms of percentage of usage, is going to be menstrual cups. And they are made up of silicone, again, non disposable, long lasting, and a very good sustainable aid for menstruation. Tampons do not find so much of application in Indian urban population, but it is definitely a very feasible kind of menstrual aid which is being used. Recently, we've also found some companies launching period underwear in India, which are homegrown brands, and that means that not having to use another disposable or non-disposable sanitary napkin apart from the underwear. These are easier in the sense that some girls are a little skeptical about introducing a menstrual cup or say reusable sanitary napkin, the cumbersomeness of cleaning it later. The period underwear has not been widely accepted yet, but it is coming up in a big form. And the last part is going to be menstrual discs, which have also been popularized by brands, the same brands who are coming up with menstrual cups. The principle is similar. It is being introduced into the vagina to collect the menstrual blood, and it has to be again removed every 4 to 6 hours, cleaned, and introduced back. So at present, we have almost 7 to 8 options.
When we are talking about menstrual cups, there is a lot of misconceptions or fear associated with it.
Yeah.
So, if you can tell us more about it and whether it can be used by both girls and women, or are there any restrictions to use the menstrual cup?
So there is a lot of fear and myths around menstrual cup in the sense that it cannot be used by young girls who are not sexually active, uh, who are a little scared about introducing a foreign object into the vagina, whether it will get stuck there, it might not come out. I do understand that no matter how much we counsel that it is okay, the young girls require direct supervision when initially introducing this. It A menstrual cup. So menstrual cup is made up of silicone. It is not made up of plastic like menstrual sanitary pads are. In terms of safety profile, it is much better, but in terms of ease of introduction or ease of learning how to use it regularly, it is not very well accepted by young girls, because initially it might be a little painful. Initially, until they get the hang of it, it might be a little painful, but the initial uh, the hiccup period only, they need to be a little more overcoming of their fears. I would not exactly insist on them going towards this either. So a lot of programs are aimed at introducing reusable cotton pads to young girls who are going to the school, so that at least they are available. They are aware of So there are a lot of girls who are dropping out of school because they do not have access to menstrual aids. So in such situation, this is a better option than insisting for something like a menstrual cup. Menstrual cups are going to be more acceptable in older teenagers and young girls in
Women.
their teens. Yeah,
But it is a more sustainable, environmentally sustainable option, and we should
definitely,
definitely think about it. At the
definitely.
same time, we have been talking about this cotton panties or period panties and cotton
Yeah.
this. So there is one question that are period panties safe to use? I think they are thinking from the point of stains, or if they can, from that point of view, maybe the question is there.
Right. So period panties do not have the layer that are present in a disposable sanitary napkin that is made up of sodium polyacrylate. It is again a synthetic substance. So what the companies who are manufacturing period panties are advocating are it can be used for as long as 8 hours. It can be washed and reused, and now there are different days of different flows, so they have certain marks to indicate which particular period panty is for a heavier flow day, which is for a lighter flow day. They are comparatively safer to use when we are comparing it with a disposable sanitary napkin, which is the most accepted method. But in the long run, if we are saying the safety profile, is it absolutely safe in terms of exposure to chemicals? We are yet to see. We do not have enough research on it right now.
At the same time, when we are talking about pads, we know that there are certain chemicals which are used. The
Mm,
covering is not natural,
definitely.
although different companies have a different advertising campaign saying that it is the safest or this. So, what is your take, or what is the care we should take if we are going for the traditional pads which are available? Or is there any thing while choosing the pad? Is there any criteria we should see?
Mm. So most of them have certain chemicals which we call as endocrine disrupting chemicals. So they have volatile organic compounds. They mess with the hormones as well as the reproductive tract because they're in direct contact with them. But it is not something which happens immediately. So it doesn't happen. Suppose a girl attains a menarche, she starts using pads and she starts facing side effects immediately. It doesn't happen like that. The local side effects, the rash, the itchiness, uncomfortability is different. They're talking about long-term exposure to chemicals. But in the long run, they are affecting the hormones of women, number one. Number two, the disposals of the pads are also affecting the environment, then indirectly affecting our food chain as well as what are we consuming. And the waste disposal, sometimes the burning, incineration are also producing chemicals like dioxins, which are again known carcinogens. They cause something called cancers. So it is not something which happens immediately. It's not a knee-jerk reaction, but it is something that we have been observing over a period of time. So as compared to any other menstrual aid, sanitary napkins is right now not sustainable because of these particular exposures, and maybe in the future going to be labeled as not as the first choice. But then when we are looking at a particular label of sanitary napkin, everyone has a little bit of a considerable proportion of polyethylene or plastic, and some of them have a synthetic top wave sheet. They will have some added fragrances. They would have certain super absorbent layer, which means increased amount of that sodium polyacrylate gel that I'm telling you. um, if possible, I would say increasing the amount of cotton in a particular pad would probably be safer than to use something which has more amount of synthetic. But then it is not for a layman to read two labels and compare and then decide. To a layman, it's going to be which is cheaper, or say which is easier to use, which causes lesser amount of leakage. And once a girl has found a particular brand of pad which she's happy with, she is going to be reluctant to try something else.
I understand. Yeah, that happens with us also. But
Yeah,
at the same time, looking at the long term effects, it is always better to have the cotton pads or these reusable pads.
yeah.
As a society, we should go more and more towards that. It is better for the health also, and it is also better for the environment. As we are talking about menstrual hygiene and health, why it is so important to maintain it, why there is so much efforts that being taken, because as I was saying about 25-30 years before, we were not talking about it. Now a
Yeah.
lot of talk is there, a lot of awareness is there, rightly so. But what are the sorry what are the consequences of not taking care of the menstrual health?
So 25 to 30 years back, we were not talking about it. I think even later, this concept of menstrual hygiene day came up in 2014. It's just been about 10 years. And before that, there was nothing like a menstrual hygiene day. And the most that we knew about periods was, some amount of sexual education classes in the later part of your school. The later high 6 to 7 standard, girls were taught about sexual education, reproductive system. But we are still living in a world where there is a lot of period poverty, by which we mean that there are still a considerable population in our country also who do not go to school or work when they have their periods, who do not have access to clean water to wash their clothes or wash their pads or the cloth that they're using for periods. There is a considerable portion of our population which still doesn't know. I mean, young girls who are still don't know that they are about to get their period, that what a period is, and they are very scared when they get their first period. So we have come a long way in understanding that we need to make our young girls aware, also the boys aware that this is a very normal and physiological part of life. And now that we are in a point where we are talking about it freely, is where we realize where is the lacuna in understanding that where did we go wrong, why did all these women suffer for all these days. So these in the past, more and more women did not go to doctors with certain problems pertaining to their reproductive health. There are still women who do not readily approach a doctor with heavy bleeding or say painful bleeding. They become dangerously anemic, they require blood transfusion, and at a point where it becomes quite dangerous to them, they approach a doctor. The more we talk about it, the more we will normalize, the more women will come to us with even the basic amount of problems, so that we can pick it up earlier, cause lesser amount of long-term side effects requiring blood transfusion, iron being transfused. That is the idea. That said, back then there was also infection which was very rampant. Now also infection is quite an important problem that we do face. Some women who do not have access to good period aids or menstrual aids, they often fall prey to some vaginal infections, some bacterial infections in the vagina, some itching, some discharge, some pus formation, which can sometimes also have internal organs being affected and long-term consequences. Now, all of this could be avoided with better awareness of menstrual aids, awareness of what is a period to begin with, and not hushing up the obvious topic of periods. So, if there is a family where there is a girl and a boy, if we are educating the girl, we should educate the boy as well that it is this is what a period is about, and this is what your sister or your mother or your grandmother do face at a periodic basis.
That's so wonderful. If we educate our boys along with our girls, they will be more sensitive to it, and the girls will have a better when they really need little bit of help from their
Yeah,
brothers, their husbands, their fathers. They will get that consideration. We were talking about the consequences of not taking care of menstrual health and hygiene, as Dr. Shrestha has rightly pointed out. Not taking care of the hygiene can lead to various vaginal infections, which can affect your various organs. There can be irritation, there can be itching. It can have a long term impact on your reproductive health as well as the overall health. And if you are bleeding very heavily during your periods and you are not taking care of it, you can become anemic. It can affect your strength and overall health. So it is very important to take care of, to know about menstrual health and hygiene. We have the experts now. We are talking about it. The awareness is created. So you should take help of these all these awareness and experts and take care of your health. We have discussed it in brief that we also have a responsibility towards the society and the environment. So how we can safely, a majority of us are using sanitary pads at the age for menstruation. So what is the correct method or the safe method to dispose the pads?
The safest method of disposing a pad is going to be in a separate container which says that it is biohazard waste. Now, we don't do that on a regular basis at homes. So we dispose it off with our wet waste, and it is sent off to the landfills or the incinerators. Now, what exactly happens to this, used sanitary napkin is different in different cities. Now, certain cities have incinerators which are at least at 500 meters distance from this residential population, and certain cities resort to landfills. Now, landfills, like we know, in disposable sanitary napkins, it can continue to exist for about 500 to 800 years. So, one of the first sanitary napkins which was used by, say, one of us during our first period might still be here in the world somewhere. Now, this is a kind of load where if we calculate, um, if a one woman uses only sanitary napkins, disposable sanitary napkins throughout her reproductive life, she'll use as many as 11,000 pads. Now, this is the kind of load we cannot afford to put on our environment, considering our population is not coming down anytime soon. Now, if that is a situation, we need to understand that our disposal system needs to improve and we need to go towards sustainable options. Disposal system here is going to be the optimal system, again, is going to be incineration. But that said, that also has to happen at a particular temperature, which may or may not be regulated right now in our government bodies. But it needs to be regulated so that it reduces the production of harmful chemicals and thereafter again affect our environment as well as us. And at our levels, we can reduce the usage of sanitary napkins which are disposable. Now, that is also not going to happen overnight. It is going to take some time. Some slow and sure steps have been taken by the girls who are aware of the other options, but there is a majority of our population which is still using disposable sanitary napkins, and that is because it has become more easily available and it's not so expensive anymore. So it's not wrong. It's something that we only popularized over time, and now we cannot expect people to let go of it immediately. But we need to make sense to them economically as well as from health point of view, and then environmental sustainability. Yes, and then it will happen, but it needs to happen at a faster rate because the kind of load that we are putting at our environment is not very smart in the long run.
It will have a long term implications, but if you are using a pad, most important thing is you are not supposed to flush it down your
Yeah.
toilet. It is going to block your drains. That is the most important thing which I will point out, because being a part of Rotary Parivar, we had this one this where we used to go to different schools and hostels, and the majority of the problem which they were facing were most of the girls were flushing their pads down the drain. You are not supposed to do it. Somebody is going to clean that drain, and it will he's the person who has to take it out. So if you are using a pad, the best way is you have to wrap it, and you have to mark it with the red pen saying that it is a biohazard waste, and you have to dispose it separately. Or best way is if you have a facility of incinerator, or you can burn it under safe environment. It is the best way to dispose the pad. It is better as a society that we go towards more and more towards the sustainable cotton pads or reusable options, so that we reduce the load on the environment we are putting on our environment. As Dr. Shrestha said, we are adding a lot of this pads the numbers are like frightening actually. So, as a woman, as we say that it is making us stronger, we should also think about the our environment and
Yeah,
our earth.
yeah.
So, we have one question that some of the women they experience this the clot spas when we are on our period. So, is there any particular reason, or we should? What is your advice on it?
Clotting is actually an indicator of heavier bleeding, and this means that there is a very simple explanation in medical terms, but let's not go into medical jargon. It actually is telling us that the body's system of making the period blood liquid is being overcome, and that's why clots are being formed. There is definitely maybe certain disease causing this particular situation. So there sometimes can be something wrong with the inner internal layer of the uterus, sometimes something wrong with the uterus, sometimes something wrong with the hormones. This definitely should be evaluated before saying that it is normal. Clots actually causes certain other issues also. Now, if we say that a particular woman has a heavier period, then her using a menstrual cup also becomes a little cumbersome, because she's using a menstrual cup, there is a clot, and then suddenly the cup is basically placed inside the vagina around the cervix on the principle of suction. And once the suction is letting go because of the sheer weight, again there will be leakage and bleeding from the side, and that causes much more uncomfortable situations for her. So if this is a situation, then we need to get it evaluated by a doctor before saying that it is normal. It can be normal in certain situations, but it most often has certain other problems causing it.
So if you have during a every period, if you are experiencing there are a lot of clots which are going, then it is better to consult a gynec and get it evaluated, because it can be because of certain problem, either hormonal or with the lining of the uterus. So I hope Shweta, your answer, you got the answer for your question. So we have covered almost all the aspects. One more thing is we have talked a lot about when the girls start the periods. Also, there are a lot of changes which happen when our period goes, or menopause, as
Exactly. Yes.
as we experience it. So, a little bit about this menopausal or perimenopausal age group, wherein any advice you will give to those women.
Yeah. So the best advice that is to be given to this woman is like, you have not reached menopause until you haven't had your period for 1 year altogether. So some women, assume that when they don't get their periods for 6 months, I've attained my menopause, and then when again the bleeding starts, they get a little scared that it is my menopause had come. Why am I again bleeding? Um, and if after 1 year of not getting a period, a woman has episode of bleeding, it definitely and 110% needs to be evaluated. Please do not dismiss it. Please do not get scared. But please come to a gynaec so that they can evaluate it. Most women in this age group think that their period is back. And at this age group, the causes of bleeding are something a little more, can be a little more dangerous than the other causes in a younger population. So um, these women are usually in the late 50s or early late 40s or early 50s, and they are a little more hesitant to visit a doctor for something like this. The bleeding might not be very significant, it might be very less, but still it needs to be definitely evaluated. This part is not so distressing to women. Sometimes they would come to me saying that we had an episode of bleeding, but that is not what is worrying me, doctor. What is worrying me is my mood swings, my hot flushes, my hair fall, the amount of anger that I'm facing, the amount of I don't feel like myself anymore, and my back pain and certain other issues. These are the others, psychosocial symptoms, and some amount of physical symptoms as well. The more important part, which we as doctors are worried about, is a sudden withdrawal of this hormone called estrogen, which happens in the menopausal age group. And it causes a lot of strain on the heart. Now, our hearts as women have always been exposed to a certain level of estrogen, a little higher when we were sexually active, or say reproductive, your periods were active. The heart gets a shock when this amount of estrogen withdraws when when a woman reaches a menopause. So these women are a little more prone to having heart disease as well. So this is the age group where they become a little more laid back. The amount of activity comes down, but that should not be the case. It should be the opposite. The physical activity needs to increase. The cardio exercises need to continue. Walking, some amount of regular walking with some sweating, some difficulty in breathing. This is the kind of exercise that I would recommend to any woman who is in the perimenopausal age group. And third part is going to be bone health. Now, as women, as Indian women, and as young as 30 years, we find that the bone mineral density is coming down at a very rapid rate. This is not because we are eating something wrong, or we're not having enough calcium. Yes, that is one of the most important causes, that in the childbearing age group or after childbirth, women are not taking enough calcium for enough time. But we are also genetically prone to osteoporosis, and it is increasing because obesity is increasing in our population. So we need to definitely improve calcium intake. Dietary sources of calcium in Indian diet is only going to be milk and ragi. But apart from that, one calcium tablet a day, starting at the age of say 30, 35, for at least 3 months a year, would not be a bad idea.
So menopause is going to come with their own set of
Yeah.
array of symptoms. Most of us, I'm in that age group. I completely understand that when you told about all those symptoms, is every day is different. But at the same time, we have to understand it is that it is again the hormones which are changing, and we have to change with our hormones. We don't have to we don't have to submit to it, but we have to find a way. The best person who can help you is your gynaec. Visit your gynaec and get a consultation. At the same time, keep your your lifestyle active. Take care of your nutrition. That will help you to tide over most of these symptoms. We have covered almost all the aspects of menstruation, right from starting the menses when they end. So any take home message, Dr. Shrestha, to all the women out there?
Well, take home message is just going to be, please don't dismiss your own complaints. That's all. There are enough, in India, there are enough people dismissing a woman's, complaints when it comes to physical or emotional and discomfort. Woman needs to be aware what is normal, what is abnormal. As a mother, if you're not aware of what is the normal or abnormal, we will not be able to take care of our daughters or our sons. So in this aspect, I would just say that we are at a point where we can be very mindful of what our future is looking at. So sustainable menstruation is going to be the focus of our lives for a very long time now, because the damage that we have done to our environment is not going to be reversed very soon. But we are still in the first part of the problem, where we still have a very large portion of our population which is still hushing up periods, and we need to move towards making it not a taboo anymore. So the theme of this year's menstrual hygiene day was going to be a period free um, world. So we need to have a world where we can talk about periods very freely, not stigmatize it, not be very hesitant about talking about certain problems that a particular girl or a woman is facing about periods, and also not dismiss at workplace. There are a considerable population which is going to work, and they are putting in valuable hours of their work. A lot more of our workforce is now women, and we cannot be the kind of population which dismisses a particular woman taking up off because of periods and ridiculing that person. So we are at a point where we need to understand that we have to be an inclusive society. We need to definitely include women, make them feel more secure in even about their periods, for them to be more economically productive as well.
Yes. So we are 50% of our world's population. Menstruation is the most natural phenomena occurring to the women. So we as a women, as mothers, should accept it. and we should be aware about what is normal, what is abnormal, and we should teach our girls to be free. There is no hush hush about the menstruation, and menstrual hygiene is not a luxury, it is a necessity, and we as a society need to move towards more sustainable aids while taking care of our menstrual hygiene and health. So thank you, Dr. Shrestha, for that informative session and explaining it in such a simple language so that our women and girls are better equipped with the information.
Thank
So
you. Thank you, Dr. Sate, for inviting me into the session. Thank you so much.
yes. So in the end, we would also like to thank All About Belgium for always supporting women's health and the efforts we are taking. So as we take the lead, thank you one and all once again. Thank you.
Thank you.